like to thank the Alzheimer Society for giving me the opportunity to talk to you today about how we might be able to use a heart scan to diagnose dementia with Lewy bodies. So, as we know from Dementia Friends session, dementia is caused by diseases of the brain, and there are lots of different diseases that can cause the symptoms of dementia. Alzheimer's disease is the most common disease, but Lewy body disease is actually the second most common disease. It's not as well known, not nearly as well known, but it actually does occur more often than you might think. So how common is Lewy body disease that causes dementia with Lewy bodies? So at Newcastle and Cambridge universities, we've done some research into this. We found that of the people diagnosed with dementia, about 6% are diagnosed as having dementia with Lewy bodies while they're alive. In Cambridge, it's only 3%. We think that this isn't due to differences in people in the North East and East Anglia, but more to do with how doctors in those different regions recognise the symptoms of Lewy body disease. But when we look at people's brains who donate their brains to research after they've died, people that have had dementia, we actually find out that a quarter of these people have got Lewy body disease, so the pathology, the abnormalities in the brain that cause dementia with Lewy bodies, a quarter of people actually do have that. So that's showing that it's still massively underdiagnosed while people are alive, and we want to try and do something about that. So you might be thinking about how can a heart scan diagnose dementia with Lewy bodies? Well, it turns out that the nerves that control things like heart rate, they're actually damaged by the disease. So we might be able to use a heart scan to look for signs of Lewy body disease. So how do we diagnose dementia with Lewy bodies in the clinic at the moment? These are the core features that the doctors look for. These are the symptoms that they look for. So fluctuating cognition, that means sometimes being perfectly fine and sometimes being very confused, and that can vary during the day. Hallucinations, so very, very realistic hallucinations, often of people or animals that aren't really there. Having sleep behaviour disorders, this is when you act out your dreams. Normally you're still when you're asleep, but when you've got Lewy body disease, the switch that controls this is broken and you can act out your dreams physically during the night. And having Parkinson's symptoms, so you might be slow or shaky. So to be diagnosed as having probable dementia with Lewy bodies, you have to have dementia and then 2 of these symptoms, or alternatively, one of those symptoms. If you just got one of those symptoms, if you have an abnormal test, and the test is shown on the right-hand side, then you can also be diagnosed as having probable dementia with Lewy bodies. So these tests, these scans are really important. This one here is a sleep study, so that is not a very convenient test because you have to go to sleep, so it's an overnight test. Tests that we can use, these are outpatient scans that we can do in the department in the hospital where I work. So this is the scanner that we use for these 2 scans. The 2 detectors that do the work are shown at the top and the bottom. So the first type of scan is a brain scan. It's called a DAT scan. It's looking at the nerves that go into the middle of the brain. So in a normal scan, we can see these elongated shapes in the middle of the brain. In an abnormal scan, in somebody that's got Lewy body disease, these shapes, they look more like dots or they look a lot fainter. So that's a sign of Lewy body disease. In somebody with Alzheimer's disease, the scan looks normal. The other scan that's recommended is a heart scan. So this is looking at the nerves to the heart that control heart rate. So in somebody who's normal and healthy, or in somebody who's got Alzheimer's, you can see that the uptake on the scan very clearly. You can see that the nerves are working very well. But on an abnormal scan, you can't see the heart, or the heart appears very faint. So Alzheimer's normal and Lewy body disease abnormal. So what is it like to have these 2 scans? I've got a video here. So this has been prepared with help from my colleague Janice, who's the technologist here, and my colleague David, who's another technologist but pretending to be a patient for this. So this is looking at the first scan. This is the brain scan. So for this scan, you're injected with a drug, and then you have to wait for 3 hours for the drug to be taken up into the brain. You then have to lie on a scanner with your head strapped in, and the 2 detectors have to come as close to the head as possible, so that we can get good quality images, which is important for diagnosing. So then what Janice is doing, she's checking that these detectors are going to go around David's head without crashing into his head. That's really important, obviously. So when she's happy that they're going to go around with as close as possible, but with enough clearance, she's going to then start the scan. And then David's got to lie there very still for 25 minutes while these detectors move very slowly around his head. So now we're going to move on to the second of the 2 scans, the heart scan. So for this one, you're lying on your back with your head on a pillow, and you go underneath the scanner, and then the detector comes down as close as possible to your chest. But the difference with this scan is that the detector doesn't move around, it just stays in one position, so you can just relax and go to sleep. And it also just takes 10 minutes, so you only have to lie down for 10 minutes rather than the 25 minutes for the other one. So it's just like that for 10 minutes. There we go. Okay, so yeah, the first scan, the brain scan, and you're on the scan for about half an hour. And the heart scan, you're only going to be on the scan for about 12 minutes. And the cost of the drug is quite different as well, with the brain scan being about twice as expensive as the heart scan. And what scans do the NICE guidelines recommend? So they actually recommend a brain scan, but they say you can use the heart scan if the brain scan's not available. So we wanted to do a study to compare these two scans and see if there's one that's better than the other, or whether the heart scan is actually useful in a UK population. We wanted to see how this heart scan compares with the brain scan, which is what's commonly used in the NHS at the moment. So we've recruited people with dementia, as well as healthy older people. So we've recruited 17 people with dementia with Lewy bodies from memory clinics, and 15 people with Alzheimer's disease from memory clinics. And then we've got 31 people over 60 without dementia that have we've also been able to recruit to the study. So this is how we analyse the heart scan. We look at the ratio of activity in the heart compared to a background region, which is in the centre of the chest called the mediastinum. And we look at the heart to mediastinum ratio. And data from Japan shows that normally there should be just over twice as much activity in the heart compared to the middle of the chest. So it should be 2.1 or above this ratio between the heart and the chest. We wanted to see if this ratio works with our scanner, because all scanners are different. So we used a model of the chest to test this out. And we found out that this ratio was no good, but we can use a higher one, 2.25. So we've scanned our 31 older people with this heart scan, and these are the results that we found. So the nerve function is on the y-axis there. So we found that 2 people actually had visually abnormal scans, so their heart scans weren't normal. The rest of the people, 29 people, the scans looked normal. But when we look at our cutoff that we found of 2.25, there's 5 more people that fall underneath this line. So 5 more of our people that have got normal scans and are healthy, they've been classed as having abnormal scans with this cutoff. So that's suggesting that the data from Japan, we can't just translate that automatically over to the UK. So we made a new normal cutoff from our normal people. And that cutoff was 1.86, so quite a lot lower than 2.25. So what were the results for people with dementia in the study? So the healthy people are on the left there, they're all above the line, the 1.86 line. Then the people with Alzheimer's, most of them are above the line. There's a couple of people who are a bit uncertain here, they're below the line. Maybe they've got Lewy body disease, we don't really know. Then the people with dementia with Lewy bodies, so most of them are under the line, which is what we'd expect, but quite a few of them had normal scans. They just looked like they were normal, healthy people. So the accuracy of this heart scan, when compared with a clinical diagnosis, this is how we work it out. So for dementia with Lewy bodies, 12 people had an abnormal scan, which is what we expect, but 5 people were normal. And with Alzheimer's disease, 13 people were normal, which is what we expected, but there was those 2 that were abnormal. That gives us an overall accuracy of 78%. Okay. The DAT scan, the brain scan, it actually worked out that it gave almost exactly the same accuracy as the heart scan. So 81%, just one more extra person diagnosed correctly. But we know the brain and the heart do not always agree with each other. And here's some examples of scans. These are 2 that are both normal. And there's two here that are both abnormal. These 2 are 2 that don't agree. And 2 more here. So why do so many scans give an unexpected result? Well, there's many reasons. Unfortunately, I don't have time to go into them. But the take-home messages from the work that we've done are that there's 2 helpful scans for DLB diagnosis, a heart scan and a brain scan. The brain scan is what's recommended in the UK. But this heart scan is quicker and easier. We think it's going to be better for people with dementia to cope with, and it's cheaper. The accuracy of the heart scan seems similar to that of the brain scan, but this was just a small study in one centre. So now what we would like to do is apply for funding to do a bigger study across more centres in the UK, see whether this heart scan really is as good as the brain scan, and also see whether patients prefer the heart scan. So thank you very much for listening.